somebody.
Okay. Here, you'll start this paperwork for me. And we'll be with you in just a minute.
Thank you.
Mrs. Coleman? How are you?
Oh, that's so good.
All right, Mrs. Coleman, can you have a seat, please? So I was reviewing your admission paperwork here, and I noticed you were having some type of abdominal pain.
Yeah, it started sometime in the middle of the night. It's like it's stabbing me in my stomach, and I just can't quit throwing up.
Okay, did you notice any changes, like maybe the things that you were eating or nothing like that, huh?
I didn't really eat dinner.
Okay. I'm going to get your vital signs real fast. Give you just a moment. Okay. You kind of hold your arm up for me. Thanks. Just kind of relax your hand for me. I'm just going to check your pulse right here. All right. Okay. All right, Mrs. Coleman, if you just want to go have a seat out in the waiting room, I'm going to take this to the doctor and let him review it, okay?
Thanks.
Thanks.
Based on your assessment, it looks like Ms. Coleman is just slightly dehydrated. I want you to start an IV with Phenigrin, 25 milligrams
Okay.
at 12.5 milliliters an hour. And be sure to chart your progress after you get finished.
You got it, Dr. Sherman.
Thank you.
Mrs. Coleman? Hey, sorry to startle you. I was coming by to let you know that Dr. Sherman ordered 25 milligrams of Phenigrin to help get your nausea and vomiting under control.
Thank you.
Okay. I am going to have to start an IV because he did order it intravenously.
Doesn't that come in a pill?
It does, but if we give it to you by mouth, it's not going to take effect as fast. So, Dr. figured it'd be better this way.
Okay.
Okay. Give me just a moment. I'll get prepped up. All right, Mrs. Coleman. I got my hands washed. I got my gloves on. It looks like I have all my supplies here, so I'm going to get started. Okay.
That's okay.
All right. First, I'm just going to take this tourniquet here and tie it around your forearm. Is that too tight?
No, it's okay.
All right. Next, I'm going to take my alcohol swab here and just give it a good cleansing. Okay. Looks like a good vein right there. So you're going to feel a slight stick, okay?
Okay.
Does that kind of hurt?
Yeah.
Okay. You bear with me. I'm trying to get it in, okay? Okay, I'm having a little bit of trouble with this one, so I'm going to go ahead and try a different one, okay?
Yeah.
Sorry. Okay, we're going to give this one a shot, okay?
Okay.
All right. This one's looking a little better. Oh, there it goes. It blew. Dag nabbit.
It felt like it
I'm really
too.
sorry. All right, we're going to give it one more shot, okay? Here comes your stick. All right, looks like we got it in. All right. Does that feel okay?
Yeah, it's a little sore.
Okay. Well, I'll tell you what. Give me just a moment, and I'll go get the doctor to check my placement, and then I'll be back with you shortly, okay?
Okay. This thing really hurt. You usually just cut me 3 times. That's quite a bit. I mean, look, does it look bad? It doesn't look good, actually. It really hurts. I think it needs to come out. I think I'm going to take it out if you don't come back in here. Come in. Hey.
How y'all doing?
Okay,
Good. How's that vinegar helping your nausea?
that actually helped,
Good.
but I don't know if it's made my hand burn or if he put that in wrong.
Is it hurting?
It's hurting really bad, and it wasn't that swollen earlier, and he had to stick me 3 times.
Okay. It does look a little red. Well, let me get with him and see if, he had any complications with it and see what I can do for y'all, okay?
Okay, I think I want to talk to his supervisor too.
Okay. I'll get someone for you, okay?
Thank you.
All right, no problem.
All right, so the judge.
You may be seated.
Angela Coleman versus East Jefferson General Hospital and Daniel Barnett, September 28, 1999.
Mr. Hartwick, call your first client to the stand.
Your Honor, the defense would like to call Mr. Barrett to the stand.
Okay.
How you doing, Mr. Barrett? Mr. Barrett, can you tell me what happened on April 15th, 1995 with yourself and the plaintiff, Ms. Coleman here?
Okay, from what I remember, Mrs. Coleman came into the emergency room. She apparently complained of mild abdominal pain, so called her back into the checkup room, performed an initial vital signs assessment, simple skin turgor check, and then she went back out into the waiting room. And I proceeded to give my assessment to Dr. Sherman, and then she gave me orders to start an IV for Finnegan to hopefully treat her nausea, and that's basically how it went down.
How was her mood that day?
Afferent, painful, grimacing. She had grimacing looks on her face.
Did she complain of any pain prior?
No, she said she didn't eat that day. I'm not sure why.
And do you feel that communication that day between you and Ms. Coleman was effective and clear?
I do. In fact, I explained the procedure, the plan of care, all the meds I was going to use, and the events needing to take place. The client verbalized understanding of the agreement and to the actions of the plan of care. Not to mention that the doctor also took part in on it by checking in on the client and administering active orders according to the symptoms.
No further questions, Your Honor.
Ms. Arnold, would you like to cross-examine the witness?
Yes, Your Honor, I would. Mr. Barrett, in your opinion, do you feel like you adhere to your hospital policy?
Absolutely.
Will you please elaborate for me?
Sure. Whenever we decided to go ahead and insert the IV catheter into Mrs. Coleman, we were, I guess she was under the impression that we were using the hospital standards, which allows a maximum of 2 sticks before you have to get a more experienced nurse to come in and attempt the IV insertion. However, I was operating under the community standards, which allows me a maximum of 4 sticks before I can get a more experienced nurse.
When my client communicated her discomfort, what did you do with that?
I assessed the site where I put the IV in, I documented my assessment, and then I went and told Dr. Sherman.
All right, I guess no further questions, Your Honor.
Prosecution, call your witness to the stand.
I'd like to call Ms. Coleman to the stand. All right, Ms. Coleman, what symptoms did you experience in the hospital with your IV site?
It was burning, and it kind of swelled up, and it was red. Very painful to touch.
Okay, and then after you got discharged, what other problems did you have with it?
It was still red and swollen, and it was so painful you couldn't touch it. I could hardly move my arm.
Okay. I have no further questions unless
And Mr. Hartwick, would you like to cross-examine the witness?
Yes, I would, Your Honor. Ms. Coleman, what exactly did Dr. Rochworks diagnose you with?
Reflex sympathetic dystrophy syndrome.
And were you explained what that syndrome was?
Basically, they told me that he hit a nerve in my hand, and it's caused permanent damage.
So they didn't tell you that you were in the early stages of that syndrome and that it could in fact cause swelling and discoloration?
No, not before. Not before the procedure.
Had you been experiencing any of these symptoms before the procedure?
No.
Would you agree that today, Ms. Coleman, that you were somewhat agitated and a bit non-compliant?
Agitated, yes. Non-compliant, no.
So you didn't hinder Mr. Barrett in his preparation of the IV catheter?
No, I didn't. I let him stick me 3 times.
And Ms. Coleman, do you feel that your agitation hindered Mr. Barrett in any way?
Objection, there was no documentation that she was ever agitated that night.
Overruled. I will allow her to answer the question.
No, I do not feel my agitation had anything to do with it. I did not get agitated until after he stuck me 3 times.
No further questions, Your Honor.
If there are no further questions, you may step down. Does the defense have any more witnesses to call at this time?
Your Honor, the defense would like to call Ms. Cheryl Jean-Fra to the stand. How are you today, Ms. Jean-Fra?
Pretty good, how about you?
Could you describe to me what the policies and certifications and procedures are in your hospital?
The policy states that no more than 2 insertion attempts before calling for assistance, but the community standard allows for 4 attempts. By this standard, the nurse was within reasonable limits by trying 3 attempts.
And in your professional opinion, do you feel that my client, Mr. Barrett, was within the Nursing Practice Act and the National Patient Safety Goals on April 15th?
Yes, the nurse was within the Nurse Practice Act during his care for the client. He was also working within the National Patient Safety Goals.
No further questions.
Ms. Sherman, can you please explain to me what reflex sympathetic dystrophy is for me?
Yes. Reflex sympathetic dystrophy syndrome is a chronic condition characterized by severe burning pain, pathological changes in the bone and skin, excessive sweating, tissue swelling, and extreme sensitivity to touch. The syndrome is a nerve disorder that occurs at the site of an injury, most often to the arms or the legs. It occurs especially after injuries from high-velocity impacts such as bullets, and however, it may occur without the apparent injury.
Okay. So, is it plausible that the patient's reflex sympathetic dystrophy was resulted from multiple catheter attempts by the nurse?
No direct causative link could be established between starting an IV catheter and the diagnosis of reflex sympathetic dystrophy syndrome. It was a slim possibility the link could be made.
So, in your opinion, the nurse was not negligent in his catheter insertion technique?
In my professional opinion, the nurse was not negligent. The nurse was not negligent in his IV catheter insertion technique. He was within his scope of practice.
All right, no further questions, Your Honor.
Would you like to cross-examine the witness?
Yes, I would, Your Honor.
Proceed.
Dr. Sherman, how long have you been practicing medicine?
About 25 years.
And in your day-to-day clinical rotations, how common is it for you to see a nurse making more than 1 attempt on an IV insertion?
About a 75% chance.
75%. So in your professional opinion, do you believe that the standards of care specific to IV catheter insertion adhered to the policies?
I do. There's adequate documentation of the IV site and the documentation of her complaints of discomfort and pain.
No further questions, Your Honor.
Doctor, you may step down. Based upon the evidence given today, we find East Jefferson General Hospital and Daniel Barrett not guilty.